On behalf of my co-authors, I'd like to introduce our study, Colonoscopy Competence Assessment Tools, a systematic review of validity evidence. Colonoscopy is an important tool used to look at the lower gastrointestinal tract for any abnormalities or disease when patients have intestinal signs and symptoms such as diarrhea or weight loss, and also to screen for colorectal cancer. When trainees learn colonoscopy, we have to make sure that we are assessing them accurately. To do this, we need assessment tools that have strong validity evidence. Validity is the foundation of a good assessment. It is how well an assessment tool measures what it is supposed to measure, or more simply, how well a tool tells us about somebody's true ability in performing a particular skill. Evidence in support of validity can come from 5 sources. These include content, response process, internal structure, relations to other variables, and consequences. Before an assessment tool is widely used, the validity evidence supporting both its intended use and the interpretation of its scores needs to be established. While a number of tools have been developed to assess skill in performing colonoscopy, the quality of validity evidence supporting the use of these tools has not been systematically evaluated. To address this gap, we systematically reviewed and graded validity evidence of published tools that can be used to observe and assess colonoscopy performance. We included English language studies that investigated validity evidence of direct observation assessment tools for colonoscopy in either the clinical and/or simulated settings. PRISMA guidelines were followed, and ultimately 13 unique assessment tools met review criteria, each with a range of validity evidence. 10 tools assessed adult colonoscopy, 2 assessed pediatric colonoscopy, and 1 assessed both. All tools assessed technical skills in performing colonoscopy, 10 assessed cognitive skills, and 10 assessed integrative or endoscopic non-technical skills. 3 tools stood out with the strongest validity evidence: the Assessment of Competency in Endoscopy or ACE tool, the Joint Advisory Group's Colonoscopy Direct Observation of Procedural Skills or DOPS tool, and the Gastrointestinal Endoscopy Competency Assessment tool, referred to as the GiECAT. These tools were made in a systematic way. They are able to distinguish novice endoscopists from experienced ones. They relate well to other markers of competence in performing colonoscopy, such as cecal intubation rate, and they can be used to help trainees who have deficiencies in certain skills catch up to their peers. These results highlight 4 important areas for future research. 1. Research is needed to evaluate barriers to implementing these tools within training programs and strategies to overcome these barriers. 2. Studies are required to determine how often assessment tools should be used during training to best support learning. 3. Research should examine the relationship between the achievement of competency benchmarks and provision of safe, effective, high-quality endoscopic care. And 4. Studies should evaluate the long-term effects of training and feedback using direct observation tools on post-certification practice outcomes and maintenance of competence. We are always trying to improve how we assess endoscopists. Using assessment tools with strong validity evidence, such as the ACE, Colonoscopy DOPS, and GiECAT, will help endoscopy training programs ensure that their trainees are receiving timely and constructive feedback to support their learning, and to make sure graduating trainees are prepared to practice safely and effectively on their own. I'd like to acknowledge my co-authors and thank Ruth Chow for all her work in preparing this video.